and welcome to the Rogers COVID-19 show. I'm Carol Merton, and before I welcome our guest to the program, I'd like to share a few thoughts with you. For those of you who watch the program regularly, we try and give you a little bit of an update on where we are in Grey Bruce around COVID. So today there continues to be good news. The provincial stay-at-home order has been lifted, and we're now in step one of the province's roadmap to recovery. However, restrictions continue to apply. The vaccine rollout continues in many locations, including vaccine clinics, pharmacies, facilities, and in the homes of those who require this service. We have now surpassed 121,415 doses administered in Grey and Bruce. The Grey Bruce Health Unit does confirm that the Delta variant present in Grey Bruce is a variant of concern, as it is more transmissible. Both the first and the second two-dose vaccinations are effective in reducing hospitalization rates from the Delta variant. The Public Health Unit could not have done this without the support of the community, and they need us to continue the good work. Please stay the course by following the 3 W's and the 2 A's advised by the Grey Bruce Health Unit. Wash your hands frequently, watch your distance, ideally 6 feet, and wear face covering correctly. Avoid crowds and arrange for outdoor activities instead of indoors whenever it is possible. This journey has been long, and we are all very, very weary. Continuing to remain vigilant will bring all of us closer to the finish line and the end result of reopening Grey Bruce and Ontario. So let's continue to keep up the effort to make this difference together. I want to thank all of you in the community for all that you're doing to help us to get past COVID-19. And I want, on that note, to welcome and thank my first guest today, Jill Umbach, who is the coordinator of the Bruce Grey Poverty Task Force, United Way Bruce and Grey. Jill, thank you for being on the program today.
Thank you, Carol.
I'm always amazed. There's so much going on, so many programs in the community, and I'm really looking forward to what you can share about what's new and how things have been going as we're moving through the pandemic. So tell me a little bit about the resources and the programs that you've perhaps added since we've chatted before. It seems a while ago.
Right. No, it has been a while. Yeah. I think that there have been a lot of programs that have been ongoing and certainly sustaining a lot of community members throughout this pandemic. I think of the community food programs, the response to homelessness, and looking at some of the other services that we regularly provide, but having to do so under the pandemic. So supporting community gardens or supporting income tax clinics. These are things that the Poverty Task Force and the United Way does regularly, but we're having to always pivot. So it was a little bit different this year for community gardens. They got started later, but now they're going on. Certainly the outbreak in Hanover at the Forum has utilized a lot of our partners in more of a disaster response. So we've been going since last March for a year. We've got systems in place and sort of coordination. So this has been an added layer of response, and it has a different nature to it as well. It's more of a critical, immediate needs for the people, and we often involve public health in the leadership, but it also involves EMS and other players that we don't normally coordinate with. So all of our community food programs, a lot of the members are responding, the housing members are responding, and plus then you have public health, EMS, and all the other factors. So that is probably a more intensive response that's happening. I think what I'd like to focus on is the challenges with congregate living, the challenges with substandard housing, and the challenges with harm reduction and our approach to working with people that may have mental health issues, that may have addiction issues. And once you hit isolation in a congregate living space where you can't, where you have shared bathrooms, shared kitchens, and people don't have the economic luxuries of going and isolating. So that social aspect to it is been the challenge that we're facing right now, and which partners are rising to and finding creative and innovative ways to do that, and really doing it with the most compassion possible. So I think that's an added little stressor for so many people in the community, as well as those within the social agencies responding.
You mentioned it, and I'd like to talk a little bit more about that particular component, because, the literature talks about intersectoral partnerships. Mm-hmm. This is an example of that kind of partnership that draws all sorts of sectors together who may not normally partner, mm-hmm. who have to spin and pivot to develop those relationships, working relationships, as well as serving the need of the community. From your perspective, was there anything that surprised you around that kind of linkage that you just didn't expect? Not that I want to put you on the spot.
No, actually, you know what? Nothing surprised me about some of the linkages. What I'm very encouraged and find very positive is that one of the things under this pandemic is that a lot of the conditions that people live in and the crises that people have in their lives are not new to our community. They have been ongoing for many years. We know that there are people living in substandard housing. We know that there is a lack of available housing. Right? Yeah. So the fact that we have challenges in Hanover is also reflective as the community as a whole, I would say. So some of the challenges that we are seeing throughout the pandemic that have been intensified are ones that we see day to day. So one of the things I will say is that what I'm not surprised about is the working relationships. We have spent a long time through our housing action groups, through health equity programming, through GIWAY, which is working with Indigenous partners to develop relationships to find solutions for homelessness. Over the last couple of years, we've been building the relationships that means that when there is a crisis like we are seeing in Hanover, we can rapidly respond, we know who to contact, we can get access to the services that we need. What we were surprised about were probably things about what is available under a lockdown, right? So there's issues around accessing clothing. There's issues about what happens when you don't have on-site laundry facilities and you're forced to isolate, right? So simple things that shouldn't be difficult can easily be overcome. But I'm always surprised when a little niggly thing like that, and you have to think, well, what do you do? For many people, they live in their own houses or apartments. They have access to washer and dryer in the building. They have access to it in their own house. And we take for granted that you'll be able to do that even when you isolate. We take for granted that another family member will cook for you while you isolate in a room if you test positive, that you will be able to get food delivered to your house and be able to afford that. So I think once again, we come back to a lot of feeling of gratitude, but also a sense of privilege. Many of us under the pandemic, if we tested positive today, would be able to isolate in our homes. And we would have enough social supports around us through family and friends to take care of us, right? Mm-hmm. When we get into congregate living situations in any place, not just in Hanover, but any of the larger buildings where you may not have those supports, where you may not have access to washer and dryer, that always surprises me. The stigma associated around somebody with mental health, that the fact that we need to continue to support that person and they need to access the service. You can't just cut them off and isolate them for 2 weeks. We need that, right? To thrive as humans, we need to keep going. And so that surprises me a little bit from if I hear a public comment that sort of says, well, this is bad and we can't respond in a compassionate way. So that still shocks me when I hear a little bit of that. But I think the positive on the side is that we are recognizing that there are, where some of the gaps are, where we need to add more gaps, and where we need to advocate for more continued support after this outbreak and after this pandemic.
Yeah. And what you're describing is, to me, it really points to the fact that we do have inequity in our system, and that this can't be forgotten, and exactly. That we need, the lessons learned are, it's increased the awareness, because in this example, all the community needs to take care of those in congregate living because it impacts all of us.
Exactly.
It's not them, it's us. And so being able to address this issue in the longer term is an important lesson, I think, as we move forward. There is some concern as well when you discuss around the mental health about the risk of depression and overdose. And are you concerned from your perspective about that?
I would say I'm very concerned about it for all across Grey Bruce right now. The public health put out an alert this week that there had been 4 non-fatal overdoses last week. So there is an alert that's gone out. In 2020, we had 20 fatal overdoses. And in the first half of 2021, we've had 10. So both the public health and all of the organizations involved are very, very concerned about this. We are concerned about safe supply. We are concerned about people being safe when they do partake, and we are very concerned that there's not enough calls being reached out for people that are in, if someone isn't having an overdose, there is the Good Samaritan Act. If you call, you will not be charged. So I think it's really critical that we continue to consider that there has been an interruption during the pandemic of some clean supplies. People are feeling the need, and people have ongoing issues in their lives and are still recovering with trauma, and we recognize where people are at. And I think that is one of the first principles of harm reduction, is to meet people where they're at, and then work with them. If we only criticize them and put them down and decide that we're just going to cut them off, it's extremely difficult for that person to cope. And one of the things we know is people are struggling. It's been a long pandemic. There's a lot of factors with people staying home. There's a lot of factors with people, not having regular access to supports and to family. So yes, very concerned about that.
Yeah. So what would you think has been the greatest program success that you've noticed? I mean, there are many success stories, but from your perspective.
Well, one of the things that is really close to my heart and which I'm really supportive of is the transformation of our community food programs to creating more of a community hub system for responding to the need for community meals, to feed food bank campers, and to fresh produce that we're getting out of the community gardens. So one thing that has happened through the pandemic is there has been more resources available to hire staff, to hire people to put more focus on these areas, and to expand programs which were in discussions prior to the pandemic, but they have been accelerated under the pandemic. So for example, we have a program, for example, to start off with, the United Way has benefited from hiring a full-time food security coordinator. And with Paul Wagner coming onto the team, he's been able to put more support both physically and strategically to our food rescue program. So this is food diverted from grocery stores. So over 55 tons of food has been diverted from grocery stores, and that has translated into community meals. And that has allowed OSHARE to then become a distribution hub. If we had not established that, we would significantly be underserving so many people in our community. We would not have been able to respond with meals, 3 meals a day and an evening snack to people in Hanover. We would not be able to supply and provide any extras out to the other community meals that are happening throughout Southeast Grey and elsewhere. And so we'd be able to create a coordinated hub whereby any food that's coming in that's surplus can be sorted, cleaned, and redistributed out in a meaningful way. The food banks have also collectively come together, and the Owen Sound Salvation Army has been sort of the hub for that, being able to understand how you can access larger orders of food from Ontario food banks and from Canada food banks. So it's really fantastic. That has happened. We've got recognizing transportation. A lot of the transportation dollars did not, well, let's just say there was no transportation dollars to be able to do distribution. We now have some of those dollars. So there is, ways that we've been looking at is how do we translate this into more ongoing, knowing that some people will be able to go out once more and be less isolated. So right now we're also in the midst of many of the programs discussing how do we support wraparound services. So an example will be in Southeast Grey Community Health Centre in Markdale. They cover Southeast Grey. They've had the YUM program, which has been providing some incredible numbers in meals, up to 1,600 meals. And they are working, I shouldn't say meals, up to 1,600 people, but they are now working to downsize a bit because of budget, but at the same time, increase and up their wraparound in-person services. So we're playing this balance game of after the lockdown, as things open up more people are vaccinated, how can we go back to some of the programming, but also how can we improve upon what we've been doing?
So the pivoting has happened during pandemic,
yeah.
But I'm hearing you say that there's still going to be pivoting during the recovery and post-recovery stage.
Yeah.
Sometimes people think, okay, 2 vaccines, we're done. We're out of here. Not true.
No. And I would say, to all of the partners out there that are working both on food security, income security, housing, it's only intensified. We've only found more people to support. We haven't found less people to support.
Yeah. And as businesses open up, people won't necessarily be going back to jobs quickly. It will take time. So do you anticipate, there's always been a need for food security, for sure, increased need because of the pandemic. So if you had a crystal ball, are you still going to be working on this a year from now, recovering?
Yes. I definitely say we'll still be working on it. It would be interesting to see if numbers go down. The numbers have not gone down.
Wow.
So even with this period, the highest was in December, but that's also around Christmas time and there's a lot more giving, but we have not seen the numbers gone down significantly. And there's always an issue of whether we're finding more people and therefore they're accessing more programs, or whether food prices have gone up under the pandemic, and therefore it's an affordability issue. We also know the cost of housing is going up, and the availability of affordable housing is difficult. So we haven't really seen an increase in people's income other than the CERB, which was filling a gap. So if the CERB stops, then we will see people that may not be covered by a gap in a rather a loss of job or a gap in income, or we will still have people on social assistance that still find it extremely difficult to be able to afford the increasing costs for food and housing.
One of the things, and I reference people and jobs and businesses, But what really strikes home to me are those seniors who are on fixed income, who are also having to consider accessing services like food banks and the meals, because their pension does not go as far. And that, I think that's an important thing to recognize, that this pandemic and food security affects all ages.
Yes.
And it's not just those who are working or those, who perhaps have been laid off, but it affects the vulnerable across the whole age and stage of life. And that was, I remember that conversation from other interviews, and it was, wow, that hadn't really sunk in for me.
Seniors are pretty proud people in general, and here I am generalizing the whole population, but what we found was in the past is still true now. They do prefer a community meal, a meal delivered to their house, somebody to chat with. They don't necessarily want to travel to the food bank. There's a lot of stigma that's still associated with a food bank, but there isn't any stigma with someone bringing you a meal. Yes. Right. So right now we are working the Meals on Wheels. Certainly that program has significantly expanded throughout Grey Bruce. And I know that our partners are working to transfer some people onto that program if they can afford it. If they're not already involved, we're also looking at, getting them connected with the Good Food Box or other things that are don't require as much money. There might be subsidies involved with that. But I still think a lot of the seniors enjoy that meal coming. And hopefully we won't have a fourth wave, and we'll be able to get back to a lot of the community meals gathered at churches and community halls where you would normally see a lot of seniors coming out.
Yes.
So hopefully we'll get our seniors outdoors more often and coming back to more community food centers where, you have that communal meal again.
Yeah, and that's absolutely critical for both mental and social health, really, for everyone.
Mm-hmm.
Can we talk a little bit about evictions, renovictions?
Right.
There was a time in the pandemic where you weren't able to, people couldn't get evicted. Where do things stand now, and what do you anticipate might happen?
Okay, so the eviction ban stopped people from being evicted from their homes, but it didn't stop notification of eviction.
Oh, okay.
So the sheriffs have been giving out notices. Now, they didn't act on the notices during the eviction ban.
Okay.
When that ban has been lifted, it means that the tenant would need to either attend a tenant landlord board meeting around the situation, or depending on the notice that's been given, the sheriff will act upon that and will physically evict you. So one of the big challenges that we had was trying to let people know that you need to pay your rent, that the eviction ban just didn't mean that, oh, I don't have to pay rent, that the ongoing negotiation with the landlord or going to the landlord-tenant board was still critically important, that reaching out to the Grey Bruce Community Legal Clinic is an option, that anytime that you do have a notification, you should be contacting either the legal clinic or attending the tenant board hearings. And if you're in social housing, please reach out to the workers if you've received a notice. In all cases, I think many landlords, both nonprofit and private, have tried to be lenient. Mm-hmm. But it is in the private market right now, it's absolutely crazy with the selling of houses, mm-hmm. and with rent evictions, and the market is just insane. And we have not very high vacancy rates, right? So people are really challenged to stay put. As much as possible, please try and negotiate with your landlord. Yeah,
critical. So before we talk briefly about the backpack program, because our time goes so fast, it's just donations. Obviously, how can people continue to support United Way and all of the community partners in these initiatives? Because as the government funding maybe changes, there's still a need, as we discussed earlier in the program. How can people help?
I think that if they continue to consider what their local organizations are doing and continue to provide funds to them, that's fantastic. As you know, the United Way is an organization that receives funds and then turns around and provides them to partners. So in providing funds to the United Way, we also then reach out to the smaller partners and to our grantees. Not all small partners, I should say, but many of them across the way. So we are somebody who gives out grants. We also have a pandemic fund, and then we do a backpack program, as you mentioned. So many partners are looking for that sustainable dollars that they can then direct for emergencies, such as what happened in Hanover. There was a need to collectively put together funding. We are, fortunate that you have dollars being matched by the county, dollars being matched by Bruce Power and other very large donors as well. So your money will be contributing and going to sustaining programs that are so needed right now.
Backpack program. Are you still doing it this summer?
We are. So one of the things that I'm really thrilled about is that the backpack program is up and running. So we will be starting this week. We've already opened it up. People can call 211 and there'll be an intake and register. Agencies, it'll be a little bit later. They'll be able to register directly with the backpack coordinator at the United Way, so we can do larger ones. And we will be ready for the schools to start in September. We are very happy that the Ontario School Nutrition Program as well, which is something the United Way supports and funds, along with the Ministry of Education, is also preparing packs and things for the summer months. So not only have we been considering school starts in September, but we've also been looking at how to support families with food and gift cards and others throughout the summer.
Excellent, excellent. So it's a positive step forward for sure. Something to look forward to. Jill, I want to thank you so much for being on the program. I always enjoy our chats together, and I'm continuing learning about how the community works together and provides this infrastructure that helps those who are needy. So thank you. And thank you to our viewing audience for joining us today. Please join us again to learn more about programs, resources, and services available to you and to your family. Take care, stay safe, care for each other. Thank you.
Thanks.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
They served to protect our homes. Now many are homeless. They fought for our way of life. Now many are fighting personal battles of their own.